Hello, my name is Drake Baston, and I am a nursing student at Indiana State University in their distance learning program. And my community health project topic I am presenting today is on American veterans and why they are a population at risk for healthcare disparities apart from non-veterans, and interventions to alleviate the challenges they face after serving our country. So here are my learning objectives. The ability to describe why veterans are vulnerable to healthcare disparities, to know the most prevalent conditions veterans are at risk of, to define distinctive needs of veterans, to understand the obstacles to diagnose and treatment for veterans, suggestions to overcome barriers to veteran needs, to understand the value of continuous research that is grounded with evidence, and to understand the importance of community awareness and support to veteran health needs. So why are some reasons veterans are vulnerable to healthcare disparities? Well, they have impacts of deployment and war are associated with varying degrees of psychological, physiological, and social impairments. Veterans also share collective principles that are embedded into behaviors that differ from most civilians. Psychological and physical damage, lack of employment opportunities after being deployed and coming back from war, financial and housing hardships related to the above. Substance and alcohol dependence is often associated with deployment in war times, and family and social challenges from being gone and deployed, especially for multiple deployments at a time. I'm now going to discuss the most common veteran healthcare concerns. According to NAMI, which is the National Alliance on Mental Health Illnesses, depression is the single most diagnosed health disorder in the veteran population. Depression is also most likely not diagnosed or reported many times, so it's most likely underreported. So rates are probably higher than we even have statistically knowledge of. However, multiple proven treatments are available that work for depression, such as medications, behavioral therapy, social support groups, and electrical brain stimulation that are only used with extreme depression, but do have success in cases that require this sort of treatment. Chronic pain is another common condition that veterans face. Chronic pain hinders a substantial amount of veterans. Prompt and thorough assessment of pain and associated symptoms are imperative to diagnosis and treatment because it could be caused from physical or psychological reasons that veterans experience this pain, or a combination of both. So treatment should be guided and dependent upon the cause of the pain and management and the quality of life of the veteran. And so opioids are used sparingly due to increased risk of abuse. So pain should be considered treatment with caution and close monitoring, and with alternative options such as therapy, physical therapy, emotional therapy, and reasons to find out why the veteran is actually having the pain as to just treating the pain. PTSD, which is post-traumatic stress disorder. You may have heard it been called shell shock, combat fatigue as well, but is defined by 4 characteristics of behavior, which is hypervigilant reactions, invasive thoughts, seclusion, and paranoia. These symptoms are related to traumatic events that veterans experience or have been exposed to, indirectly from internal or external environments, situations that they have been exposed to even before war or during war periods of time. PTSD etiology can be physically and or mentally induced. Treatment interventions target multiple types of therapy, including medications and social programs, and evidence-based methods for surveillance and care management are utilized to help treat PTSD and come up with better solutions of treatment for PTSD, because this is a multifactorial diagnosis that is not as easy to treat than depression or other mental health diagnosis. Substance use is another common issue veterans face because soldiers often start coping with high tension military demands by using substances such as nicotine, like cigarettes, alcohol use, and medications such as opioids. This in turn increases the risk of long-standing unhealthy habits for veterans. Prevention of this concern should be implemented by encouraging healthier coping mechanisms while active duty and educating them on the harmful impacts of long-term use of these substances. Interventions to treatment should also focus on evidence-based practice with surveillance methods on the etiology of substance use in the veteran population. By using such techniques, they can, dive deeper into the reason and rationale of the dependency, and such as anxiety or depression, and start treating that underlying condition as much as possible to help the veteran cope in a healthy, more productive way. Suicide is another big concern related to veterans. On average, 20 veterans a day commit suicide. Mental illness, trauma, injuries associated with excessive alcohol or substance abuse have a higher prevalence of suicide in the veteran population. Veterans under the age of 45 are most vulnerable to suicide. However, all veterans have a higher rate of suicide than most populations in our society today. Continuous monitoring and expanded education efforts are essential for healthcare professionals to become more aware and provide more education to the community on how to prevent suicide among the veterans. I have listed here some additional predispositions veterans are at risk for, which are severe brain injuries related to war, which can cause bodily damage, loss of limbs, exposure to harmful substances that can create respiratory illnesses in the future, difficulty adapting to civilian life after being at war or deployed for a long period of time, and homelessness is another big issue veterans unfortunately face. Here are some distinctive methods for comprehensive care related to veterans. So, utilizing current care services to veterans based on updated healthcare needs by locations includes statistical information on veterans with the National Census surveys more frequently, distinguish veteran health needs of multiple generations as war and deployments have changed over time, facilitate ease of access to healthcare to all veterans, expand healthcare provider coverage, including nurse practitioners and other mid-level providers training veteran health needs to accommodate reasonable appointment times, utilize technology such as telemedicine when appropriate to broaden access to more veterans. Collaborate efforts to prevent barriers to veterans' essential needs, community engagement with veterans making transitions into civilian life, cultivate knowledge and skills obtained with military roles for career opportunities for the veterans, include education pertaining to military and veteran health needs into medical and nursing programs such as what I have listed here below, which is the American Association of Colleges of Nursing. It's a good care toolkit that is available, offering comprehensive education to healthcare providers on population that is vulnerable, like veterans, support that evidence of providing culturally competent care is essential to best outcomes. The importance of continuing research and evaluation. Many protocols used by the VA healthcare system that improve techniques to evaluate and diagnose veterans with PTSD come from research and continuing research and evaluation. Evidence-based conceptual health models such as the PCMH model are used to streamline veteran healthcare needs, weighing importance of primary care. Evaluating processes in place is essential to provide quality control and improvement opportunities to meet or exceed set goals. Healthcare needs of veterans change over time, therefore research is necessary to remain well informed of evolving health and social needs to deliver the best care possible that is most deserving of America's veterans. In conclusion, veterans around the country rely heavily on government-owned healthcare such as the Veterans Affairs System. While the VA offers many benefits and programs, there are areas for improvement. Accessing care is inconsistent and limited. Services are offered depending on each facility and location. Involving the community along with healthcare providers and educating the needs of veterans can render improved care. Anticipating the needs of veterans with research and surveys can facilitate policy changes with organizations to meet the current and future needs of veterans in America. Thank you for your time, and I have included the pre and post test if you would like to look at that, as well as the flyer on this presentation. Thank you.